I'm not the house of cards that falls down easily. Oh, I'm strong enough to handle what you throw at me.
Welcome to Mental Health News Radio. I'm your host, Kristina Hallett Walker. Just what are we going to discuss? The intimacy that is mental health. Let's continue to make it as comfortable as discussing brain health or heart health. This show has been on the air for several years, and we have amazing co-hosts. And then we created a network of podcasters on mentalhealthnewsradionetwork.com, a place where every possible facet of mental well-being can be talked about openly. My show, after several hundred interviews, the format is this: intimate, deep, funny, touching, sometimes uncomfortable, but always vulnerable conversations with interesting people. The goal is to have you, our listening family, many of you who have become my good friends, feel as though you are listening in on private conversations. Thank you for tuning in and becoming part of this amazing journey with me, and now with our network of podcasters. Just knowing this podcast might be helping any of you realize you are not alone on this journey called being a human being makes doing this podcast worth every second.
After all, we promised we'd be cordial.
Yeah, how are you today, Kristina?
I am fabulous. So this is such a great opportunity, I think, for us to really get a better understanding about occupational therapy. And I definitely want to know about all of the letters and what they stand for, because every time I see OTR/L, I think, all right, I'm guessing the L is licensed.
It is.
Yeah, so can you explain that?
Yes, so the O and T are for occupational therapist. And in our field, you need to be registered to practice. So the R is for registered, and we do OTR, because if you did ROT, it would spell rot, and nobody wants that.
Exactly.
So we are all registered occupational therapists, so OTR, and then we also are licensed in our states, and you get the /L for the license.
So you've got to be both registered and licensed.
Yes, so there's a national exam that we need to pass after graduation and doing field work to prove that we have, the entry level components that we need to be occupational therapists. And once you pass that national registry exam, you are allowed to have the R, and then you become licensed in the states that you practice in.
Thank you for explaining that. That was sort of my guess, but I didn't realize about the registration. So that's helpful. And I know it's one of those things people always ask me about, like, what are those letters? And I'm like, the ABPP is like secret psychology language, so nobody cares anyway. So
Yeah.
I think it's so helpful to understand that. So OT, when we're talking about occupational therapy, I know that there's lots of different ideas that people have about what that involves, but I'm suspecting that most of the time people's ideas are much smaller than the breadth of what you do.
That's absolutely true. And the first thing I always tell patients is, no, I cannot get you a job. That's vocational. And we define our profession by the word occupation. And by occupation, we mean any activity that you do throughout the day. So whether that's get up, put your feet on the floor and get out of bed in the morning, or you go and have a job perhaps, or you're taking care of your child, your pet, you are showering, you are going to the grocery store. Those are all occupations that we do every day.
That makes a lot of sense. I get that. So this is not just for, let's say, recovery because someone's had an accident.
That's right. You can find occupational therapists in a lot of different fields, like mental health. They're obviously a big in what we call physical disabilities, and those are people who are having some type of physical issue like recovering from an accident or a stroke. There's a big presence of occupational therapists in that as well. We also work in schools with children. We work with early intervention with very small children and their families. And so we're just about anywhere you can imagine, you could have an occupational therapist working there to help you improve your occupations.
So tell me more about the mental health piece, because I think that that's something that's going to be so helpful to our listeners and is likely not something that they've necessarily even thought about.
And that's true. You don't often hear about going to see an occupational therapist when you're talking about mental health. Now, I worked on an inpatient psychiatric unit for many years as the main occupational therapist. And, the things that we do is anything to help with your occupation. It could be recovery based, it could be any type of mental health issue that you're faced with. And we work out in the communities with that as well. In community mental health centers, there are occupational therapists. We work inpatient. You might find them in addiction recovery sites. And again, what we're working on is occupation. And I like to use the word function. To me, that is kind of what sums up. I want you to be able to function at your occupation, whatever that looks like for you. For example, I don't particularly enjoy grocery shopping. I find it horrendous. So I send my husband.
Peapod, right?
Yeah. I send my husband to the store. I give him a list. He goes, it's taken care of. So I'm functioning at getting food in my house, but I'm not the one doing that particular occupation. So there are ways to get around occupations that you may not like or you may not be particularly good at, and that's okay. We don't all have to be 100% at every occupation we do. And as adults, we don't have to do every occupation. We get the choice. So when you're talking to somebody that has, say, depression and is having a hard time getting out of the house, and I'm like, well, you know what? Some days we get up, we take a shower, have a cup of coffee, and that's a good day. Those are occupations. And that's our level of function. And we get Peapod to send us food or order pizza.
So if we think more about depression, what are some of the kinds of interventions or ideas that you might suggest to someone aside from, and I love that you just said that whole sort of normalizing the idea that you're working to the extent that you can on a particular day?
I like to talk to people who have depression because, again, I was working in an inpatient unit. So I'm seeing people who are really struggling even to get out of bed. And I like to start with the simple, we call them ADLs, activities of daily living. And that is things like getting up and brushing your teeth, taking a shower, putting on an outfit you enjoy wearing. And I like to talk to people about tackling that one first, not only as an activity of daily living, but also as a part of self-care.
Mm-hmm.
Anything that we can do for ourselves that improves our overall not only mindset but physical health, which a shower and flossing and brushing your teeth will do, improves our mind as we go forward. And I like to tell people every time you can check something off your list, you just had an accomplishment that day. So we start off.
Absolutely.
Yeah. So I start off with that. I start off with, let's get up, let's take a shower, let's make sure we have something we want to wear. And if what you want to wear is oversized sweatpants and an oversized sweatshirt, that is great. If you want to dress up, that is fine too. And then after that, we kind of focus as occupational therapists on what is the occupation you want to do the most. So for some people, it might be, I'm having trouble getting food in the house. For some people, it might be, I want to be there for my children. So depending on what a person wants to work on, that is kind of what we develop with them. We might work on developing leisure skills so they have some downtime for themselves. We might work on some education, like being assertive or having some more interpersonal social skills. Being able to set boundaries with people is really important. And I always tell people it's really hard to do. Just because I say you should set a boundary and show you how to do it doesn't mean you can leave and do it. Possibly we talk about roles. Do you want to be a better parent, a better daughter, a better friend? How do you want to work on that? So we really it's occupational therapy is a client-centered profession.
Mm-hmm.
So we really work with our clients to see where do you want to go next? What should we be working on?
So let's say that I'm a person and I'm out in the community, I'm not inpatient, and somehow, we can get to the how after, but somehow I've been really struggling. I'm pretty isolated, I'm pretty depressed, and I come in contact with an OT, and I know that I'd really like to learn about leisure skills, assertiveness, and boundaries. From a specific perspective, what's an example of something that you might help that person to do?
So we do different exploration activities. So perhaps a leisure checklist first to see what they're interested in, and we can work through that with them. Oftentimes it has a list of over 100 different leisure activities. And we also talk about what's valuable to them. So is it something that they're both interested in and is valuable to them? So if I'm interested in tennis, but investing the time in a racket and going to the court isn't really valuable to me, then what are the chances I would complete that? It's fairly low. And when you're working with somebody who has depression, we don't want to set tasks that are setting a low bar to complete, that you don't have a lot of motivation to complete, because that's not going to be good for anybody. So exploring both what you're interested in and what is valuable to you is one way to look at leisure.
Mhm. Now, what about sort of how do you see the overlap or the similarities between mental health counseling and the kinds of things you're talking about in terms of an occupational therapist working with someone?
So there is some overlap. A lot of people see that. Usually, when you're talking about mental health counseling, you're talking about a lot of individual sessions and possibly bringing up the past and discussing emotions. And we more focus again on the whole occupation part of it. So if we want to talk about parenting and communication skills with, say, an ex-partner, we might focus just on the skills of communicating and being a parent, and not necessarily asking people how they feel about what happened in the past with them or bringing up anything like that.
So that's a really interesting distinction, because I just had a conversation with someone the other day where we were talking about trauma, and that the one of the newer things that we know now in the field of mental health is that we don't necessarily need to go back and over and through the details of trauma. That in fact, sometimes it's really helpful to simply start where the person is and have an awareness of how it is, a knowledge of what may have occurred, but really focusing on the present and moving forward. And I know a lot of people in the mental health field who it sounds like are doing some of the things that you're doing. So that if a person is, let's say, as we talked about, depressed and having difficulty getting activated and doing things. Similarly, I know in my office, I have a list of about 100 different cards that are color coded with different activities, and I might have them sort them into things they might possibly do, would likely do, and would never do, and then look at what's one or two from the they would likely do and see how we can do that. Does that sound similar to what it is that you're talking about?
It is similar. There's actually, funny that you should mention it, we actually have an activity called an assessment called the card sort in
Mhm.
occupational therapy. But it's not just focused on leisure, but it has several things like that. Um, and it could be similar. The big thing that we talk about in OT is the occupation and the fact that we're focused on that. So once we perhaps identify the occupation, then we really work with our clients to make sure that they are able to adapt their environment at home or work to be able to be successful as that. We might facilitate that skill to help them and provide training and kind of help them just continue on different occupations and different roles that are important in their lives.
So if a person says, "Hey, I have an interest in working on boundaries," what do you do to help somebody develop better boundaries?
I like to go back to the key communication skills
Hmm.
and start there. So starting with, first, can you identify emotions in others? And I obviously don't spend a lot of time on that. That's not my expertise. My expertise is in the actual occupation of setting the boundary. So we would say, okay, in the classic, uh, you feel blank because line that we teach with communication. So you feel upset because when you tried to contact your partner, there was a misunderstanding.
Hmm.
And then moving from there to helping people understand that it's okay to set boundaries as an occupation, or to function in an occupation in our lives. So in order to function as a parent, we may need to set boundaries with our own parents, our partners, teachers, and then teaching them the skills to be able to, say no to something, to be able to say, you are not allowed to talk to me like that, and decide where their boundaries need to be set and what they're comfortable saying to people.
In what ways do you meet with people? Is it individually? Is it in a group? How does that go?
So yeah, we do a lot of group sessions in mental health for occupational therapy, but we can meet individually as well. So depending on what setting you are in, you often will see occupational therapists running groups, and sometimes you will meet with one individually.
So I get that on an inpatient unit because that makes sense. And you've obviously got this whole collaboration with a team. But what about the person who's just living in the community? Is there a way for them? Who refers them? How do they access this? Is it something you recommend?
So you would need to be referred by either your psychiatrist, your primary care physician, whoever your main treatment person is. And then there are private practice occupational therapists out there. Also, community mental health centers in the community often employ occupational therapists. So I know I live in Connecticut, so CHR employs quite a few occupational therapists. They're our local community mental health center, and so does, I want to say it's CHD in Massachusetts.
Mhm.
So you could go to either of those places and there would be occupational therapists there. And again, mainly there you're running a group. They're going to be seeing a lot of people at the same time. And that does offer a lot of benefits like peer support for people. You can see that you're not the only one going through this. And it offers a lot of benefits of being a member of the group, working together and maturing. Um,
Sure. Now, do you work collaboratively with people's individual therapists if they have that as well?
Absolutely. We'll work collaboratively with whoever you would like. It can be your psychiatrist, your primary care physician. It can be your social worker, your private therapist. We have no problem doing that. We're very interdisciplinary in occupational therapy.
Which is fantastic. I guess the biggest thing that strikes me is that I don't know that private mental health practitioners, so I get it again with a community health center or an inpatient, but do you think that private mental health practitioners are aware that OT is a potential adjunctive support for the work that they're doing with someone in therapy?
And that's a good question. I'm not sure people are. We're not as well known in the mental health field. Yes, as you stated, we are employed in hospitals and community mental health centers, but privately, you don't see people referred to OT for mental health all that often. A lot of times, we like to say mental health is everywhere. So a lot of times, when you're going, say, outpatient for arthritis in your hand, you might end up getting some mental health support from your occupational therapist that way. But to be referred for mental health to an occupational therapist is fairly rare in the community where we're trying to make a bigger presence, especially I know in Connecticut and Massachusetts, because those are the two states I work in. So I'm a little bit more familiar with what they're doing. But it's a bit of a slow road because we are not as well known.
Yet it seems like it makes so much sense because then you would have yet another setting and another person to really support, no matter which end it started from, this ability to really make a difference in those areas that are the person's primary concern so that they're having successes to build on.
Absolutely. I've always said, and occupational therapy, we got our start in mental health back when we started right after World War One. So we've always said, most OT practitioners will tell you that, it's a big part of our history and a big part of how we treat our clients as well. So it would make sense to have us as an adjunct in the mental health field, as, a more available adjunct.
Now, if I'm a listener listening to this and I think, wow, I'm not in counseling, but there's some places I'm really stuck. Maybe that could help. Can a person, I guess they have to have a referral, right? They can't just sort of call up someone on their own, but
You
could
do
they
need to
go in
have a
and,
doctor's referral for occupational therapy, yes.
all right. And does that have to be an MD? Like, can a psychologist do that?
As long as you can write a doctor's order, then we can do that from there.
Doctor's order.
Yeah, that's the
Meaning, right. So, but associated with whom, right? Because that's have to be associated with a practice. I
no,
think
as
about,
long as so it could be an APRN, it could be a PA, it could be an MD, it could be a psychiatrist. Um,
okay, but not a psychologist in that sense. So that's not something I can't just refer someone for that.
Probably not.
Very interesting.
Historically, yes. We are not, I don't want to say historically, that's the wrong word, since historically we were built on mental health, but currently we are more associated in most people's minds with the physical side of disabilities and not the mental health side. Part of that is because we have built a big presence in physical rehab, the profession has. And, part of it is simply that the way we reimburse or are reimbursed from insurance companies is not the same as psychologists and psychiatrists. So sometimes it's easier to find a social worker or a psychologist to talk to than it is to find an occupational therapist.
So you're getting your doctorate in OT.
I am, yes.
And I'm sure there's a lot, but what are the differences at the doctorate level?
There's a lot of research-based information to work at. So as occupational therapists, we work off evidence-based practice, which means things that have been researched and have been proven to work.
Mhm.
And you learn that as an entry-level therapist, and you're like, yeah, that makes sense. I'm doing stuff that people would want to do. But at the doctorate level, you're the one kind of synthesizing the research and looking at it and going, you know what this field needs? We need to look over here. And then starting to add some of those components of evidence-based research back into the profession.
Oh, that's great. So do you have an idea of what it is that you're going to be looking at?
Well, actually, I'm going to be graduating in May, so I am finishing up my research right now. And what I did with the help of BAPATH, the Dean of Students, and our Dean in the School of Health and Human Sciences, and that, of course, my department chair, is that we built a level 1 fieldwork. So occupational therapy students need to go on both what we call a level 1 fieldwork, which is kind of an observation and interacting with people, but you have a supervisor with you at all times. It's called line of sight. There must be somebody with you.
Mm-hmm.
And then there is a level 2, and you have to complete 2 level 2s in order to be an OT. And those are 12-week kind of internships, completely unpaid, of course, because
Of course.
where you basically work full time under the supervision of a practicing occupational therapist. And that can be in a hospital, in a community center, it can be in a rehab center, or a school, wherever we send you. And you have to complete and pass 2 of those in order to sit for your board exam. So my project is a level 1, which means they're doing not quite as intensive, but we're taking graduate students, the Masters of OT students, and they are running groups on the BAPATH residential campus
Oh, what are
for
they
the
doing?
undergrads.
That's
They have been, I taught them about group protocols and group dynamics last semester, and they got to choose what they thought would be best for undergraduates. So what they did is they went out as part of their needs assessment. They interviewed different people like Ann Chapdelaine, who is our Dean of Students at BAPATH University. And they also went to the dining hall on several nights and polled some of the undergraduate students to see what they'd be most interested in. And what came up this year was stress management.
Mm.
Everybody, of course, anybody that's ever been to any type of schooling knows it can be very stressful. You have different teachers telling you what's due when, and you have to do it this way, and this is due. And so we have been running groups right now in the evening, but we're going to try different times to help undergraduate students deal with stress of being at university.
That's fabulous. That's, I'm sure, something that's needed all across the country.
It is, and it's interestingly enough, this is the first out of all the research I've kind of combed through. This is the first program I found where an occupational therapy department is collaborating with their actual undergraduate team in doing this. So it's a little bit trendsetting.
Yeah. Now, are you hoping that you're going to come up with sort of a protocol that could then be shared with other colleges and universities?
Yes, so we're kind of hoping that that'll happen. We're also possibly, this is very tentative, looking at a bit of expansion next semester and doing this almost year-round at BAPATH rather than just in the spring, where we can have the students that are currently there do it in the fall and the incoming ones do it in the spring and kind of keep it going, which will change the program a little bit, but gives a shot at even more research to back up why this is a good thing. And then we could possibly implement this on other college campuses.
Love that idea. Now, as you know, stress management is like sort of my thing. So, what are some of the things that you're doing with college students? You're talking about an all female, at the moment, all female undergraduate college community. So, I'm curious, what kinds of things are the students doing?
So, and it's all female OT students as well that are teaching our female undergraduate students. And our OT students, our occupational therapy students, get to come up with the ideas. So, some of the ones we have done so far is the first one we did is they made stress balls. And they used balloons with rice. And a lot of the undergraduates said they had never made one with that particular texture before. And so adding that sensory piece to it, a lot of them really enjoyed that. The last one we ran just this past week was talking about music and understanding how music can either up your mood and kind of make you want to go for a run or do some exercise. It can calm you when you're trying to study. And we explored through, they did some art as well as playing the music that the students chose to explore what that meant to them and how could it not only decrease their stress, but possibly improve their study habits.
Oh, I love that. That's one of the interventions I suggest to people all the time. I'm always saying, create different playlists that can take you from, let's say, agitated or angry down to more neutral, or from sad or depressed up to more neutral. And you can literally have a playlist for everything.
Absolutely. And they really enjoyed that one too. And we did a little off the box or out of the box the other day where we did body image. We talked about how the changes in what the media shows as body image and Instagram, Snapchat, and all those apps that I don't have, but the kids use, how that can affect your self-esteem. And in turn, does that make you more or less stressed as you go through life? And if you're more stressed and you're on an all-female campus, are you comparing yourself to other students? And how does that feel? And is it a more accepting community? And what does that do for being your stress levels? And I have to say that was a real big success. The undergraduate students loved it, and they do talk about how accepting Bay Path is as a community. But they got to talk about how they can feel free to express themselves, but in the past, maybe they were having trouble with different body image, and how we all realize Instagram isn't real, but it's right there.
Right. It's sort of hard to ignore it altogether.
Yeah. So, and that went really well. And the link to stressed with them, I was like, oh, I'm not sure how we're going to pull this off, but they did a great job. And at the end, everybody said they didn't realize how good it felt. Like on the days they put up their on makeup, they felt more confident, and they felt that they took better notes in class when they were more confident. And we had one girl who said she purposely dressed up for all her exams.
Oh,
And
what a
she,
great idea.
yeah, and she felt that really gave her an edge because she left the house feeling her best. So it increased her confidence. So it decreased her stress.
That's great. I know we're almost out of time, but I want to go back to the stress balls for a second.
Oh, sure.
Because I think that that's something that potentially our listeners might be interested in checking out for themselves. So can you say something about why stress balls are helpful, and then how do we make our own?
Absolutely. So stress balls, they can ground you. You have something in your hand that you can hold on to. You can time your breathing to the squeeze. You can squeeze both hard if you're angry, or kind of change up how, try to go as soft as possible. They're also, honestly, they're good exercise for your hands too. So there's lots of benefits. And when we make stress balls, a lot of times we use different textures. So for example, if you make one that's filled with flour, it's going to feel a lot softer and kind of a little bit harder to squeeze. You don't get as much proprioception back or as much feeling back from it. And if you fill it with rice, the rice particles tend to move around more, and it also gives that kind of almost beaded texture to your hand. So you get that a little bit more grounding feeling, and you can put more pressure on them.
So you literally just sort of hold open the mouth of a balloon and put rice in it?
Yeah, it works best if you have a funnel.
Okay, that makes sense. I was trying to figure out.
But you can do it without. And it also works better. So if you get a balloon, and what we did, it must have been about 3 weeks ago on campus, we got multicolored balloons. If you ever go to a dollar store or something, the ones that are like brightly colored and swirly, we had those. And if you blow it up first, it helps stretch out the latex a little to get some more whatever your medium is going to be that you put in there. So I have done them with rice, with small beans, with flour. You can do them with like a gel-like almost shampoo. The only caveat with that one is if that one breaks, you're going to have a mess on your hands. It's a little bit easier to vacuum up rice and beans than it is to get hair gel out from wherever you're going. But the interesting thing the kids did this time, which I had not done before, is they made their stress ball. And then, and this was a challenge, it took 2 people for a lot of them, they put that first balloon inside another balloon. So, and that's a challenge because you have to stuff it through the neck. And then what they had them do for the second balloon is cut the neck off so it's a little bit bigger opening.
Yeah.
And then you tie the first and the second are both tied shut.
Okay. So it's
decreases the chance of accidents. Yes.
Got it.
Yeah.
Oh, I'm just sort of picturing that and thinking I'd probably need 2 people other than me to do that. But that's a great idea. And I think, so I'm thinking about that and I'm just thinking that's exactly the kind of thing that people need to know more about because it's so helpful. It isn't, we're talking about buying a balloon and a sort of probably get a pack of 15 for $1 or $2, right? Yep. So that we're not talking a high expense thing that can really make a difference in managing stress and in self-care, plus the whole creative aspect of doing it. And as you're putting it together, as well as the trial and error part, particularly if you're using different mediums, are all super geared towards really supporting brain growth.
Absolutely. And that's one of the great things I like about it.
That is a fabulous example. I know I'm going to try doing this. And listeners, I encourage you to try doing this as well. It sounds like a lot of fun. And it's better than paying, $9.99 for an official stress ball from the store because this gets to be your own.
Absolutely. And we did, that was one of the questions we asked the undergrads. Did they think they'd be more likely to use the one they made? Or if they went out to the store that night and bought one, what would they be more likely? And they chose the ones they made. They said it really, the effort to make it and they got to fill it to their size, what they wanted. It really made a difference.
Yeah, it's customized. So before we end, any other specific tips or ideas that you think would be helpful for people just in the community and our general listeners to know about OT or great ideas that you have?
Feel free to always ask your referring physician, whether it be a psychiatrist or a medical doctor, to go to OT. We do a lot of great things for people. I also like to mention self-care when we're talking about mental health, and that can be as simple as, taking yourself to Cumberland Farms for a 99-cent coffee, getting out of the house for 10 minutes, or taking a shower, where we're making sure that we're doing an occupation that's meaningful to us and just us, and taking care of ourselves, our own mind and body, to make sure that we can take care of others if that is one of our occupations.
Absolutely. I so appreciate your time. And so you're working at Bay Path University and you're going to be completing your doctorate. Yay. So May is graduation. So soon you're going to be Dr. Deborah James?
That is true, on May 17th, I believe, this year.
Fantastic. Yay. Thank you so much for taking the time to talk with us today.
Thank you so much for having me. I loved it.
This was great. So everyone, you've got the idea here. Look into OT, talk to your provider. It doesn't have to be specifically because you're in a major crisis. This is a really excellent additional support that you can do. And for sure, make yourself a stress ball. I know you're going to love it. Take care and have a great day.
Sometimes I'm passive-aggressive, but never without good intentions. I heat up and act on my emotions.
Thanks so much for listening to Mental Health News Radio. Our podcast can be found on iTunes, Stitcher, and hundreds of other podcast apps, or you can visit our website at mentalhealthnewsradio.com. If you have a question or would like to be a guest, become a podcaster on our network, or join the amazing organizations that help keep us on the air, please email us at info@mhnrnetwork.com. Get ready for that special goodbye from our resident therapy dog, Miles, and a special thanks to Emily Sohn for letting us use her incredible song, Cordial, for our podcast music. Listen to the full song on SoundCloud at emily.sonne.
Don't be surprised when I don't hate on you. After all, we promised we'd be cordial. Sometimes in you I can fight it, but I'm opposing.
Good boy.